am Dr. Mbuli. I am currently the General Manager for Health Policy Unit and Medical Advisory at Afrocentric Group.
Lovely to have you today, Dr. Mbuli. How are you?
I'm good, thank you. And how are you?
I'm very well, thank you. Just to not take too much of your time, it's a public holiday today in South Africa. So recently, the National Institute for Communicable Diseases, NICD, reported that cholera cases, including one death in Gauteng province, have risen. So can you tell us a bit more about that study? And we do know that cholera is caused by contaminated food and water. How can people, for example, that cannot afford to buy bottled water, try to eliminate chances of contracting cholera?
Okay, I think, and this is something when I was actually speaking with my family. So I think I just want to take us a step back to actually just define what cholera is. So it is a bacterial infection that causes vomiting and watery diarrhea. And as you've mentioned, you do get it from contaminated water, contaminated food. So recently the what was published is in South Africa as of early March. It hasn't really been updated recently, but early March, there were 6 known cases in South Africa of cholera, and all 6 of those cases were in Gauteng province. So 3 of them, it was confirmed that they did get the cholera or they got infected from Malawi, which is one of the countries currently. Malawi, Zimbabwe, Mozambique are currently countries that are also going through an outbreak. And the other 3, the government is still doing its investigations and surveilling on where they could have contracted it. Is it a local outbreak? So that is important to understand that, of course, there could be, yes, you've traveled, but we need to do the due diligence on if those who have not traveled, are we dealing with a case in South Africa? Now, with regards to cholera in general, I mean, it is very much treatable. 80% of people are treated. Like you said, there was 1 death. So when it comes to the deaths, it's always the vulnerable population. So it's always, the young, the elderly. So you really don't want them. You don't want anyone to get cholera, but most of the time, if somebody does die, it's because, there was also underlying things, and therefore, that could be the reason, or it wasn't caught fast enough. Yeah. So in terms of, what we can do, I mean, it just goes back to, what really causes it. So the fact that it is contaminated water, contaminated food, and unfortunately, being South Africans, we are already a nation that's at risk because of, we have a lot of people in informal settlements. So places that are overcrowded, places where your water source and your source for using the loo are the same source. And, it's almost like you're drinking the water, but you're also washing your clothes in it, but you're also using it for sanitation. So those are the dangers that we face in South Africa. So what we can do, I mean, it is really we very much rely on the communities. So the government can surveil, but it is, like you said, that at the end of the day, communities and what they can do on the ground with what they have, because we do know that, yes, there's lots of infrastructure issues, but what can we do with what we have? Yeah. So things like, boiling your water before you drink it, making sure that when you do go to the loo, you do wash your hands, making sure that when you are preparing food, that you wash the food thoroughly and you wash your hands thoroughly. When the food is prepared, make sure it's covered. In most instances, like I'm talking about, our rural areas and people that don't have access to fridges and that, make sure that the food doesn't sit for too long. When in terms of disposing of things like diapers and nappies, make sure that they disposed, properly. Like I said, don't drink the water where you're also doing your washing. So kind of separate those things. So it just goes down to hygiene. Yeah. If I can put it in one. Yeah.
Makes sense. Doctor, you mentioned quite a list of things, and I will just start with the boiling part of the water. So, as a country, currently, we are battling load shedding. So, is there maybe another option for people to try, maybe sift out the dirt from the water, other than
Yeah.
boiling?
So the issue with that is obviously with you can sift out what you can see. So if it's coming out of the taps and it's brown or there's granular, you can sift that out. But at the end of the day, you do need to clean the water. So yes, the droplets you or the granules you've seen, you can, but there are other things like normal household bleach, where if you put like 2 drops in a liter of water, but obviously that, please, people must be sure if they're doing something like that, because I don't want it to be, I said put bleach in water and then drink it.
Yeah.
But you can, like with 2 small drops of bleach in a liter of water, and that also, acts as I'll say, a filtering system of the water. But it is a big issue, because at the end of the day, the boiling is the best and I'll say the safest way, as opposed to trying to use chemicals.
Makes sense. And the role of government and organizations, how can government and organizations assist in fighting cholera?
So right now, actually, the World Health Organization is actually doing a series webinar on cholera. There's actually a webinar today that people, if they go onto the World Health Organization website, they can log on. It's actually a webinar happening later on today. So it's really about educating people. Like I said, at the end of the day, what the government can do and what the global society can do is surveil, which is what is happening like now with the current outbreak. But it really is very heavily reliant on communities to actually be educated and understand what this condition is, and how they can help combat it. And like I said, unfortunately, you have to work with what you have, and at the moment with what you have is really educating communities on, yes, your water, you don't have safe water, but how can you work with that unsafe water? How can you protect yourselves? So it really is about, outside of the big infrastructure things, it really is about educating communities. From a government perspective, is making sure that people that have, I mean, it's not only a humane thing to do, but that people have access to sanitation. There's still people that are openly defecating, and if you're openly defecating and, that's trickling down into water sources and all of that, that in itself causes an issue. Now, you can't say that communities, I mean, what must they do? If you don't have a toilet, what must you do? So I think from a global and government perspective, there should be a really big push still that people should really have access to a toilet.
Absolutely. And what I'm getting is that you are also saying that people must also take accountability. It's not just the role of the government and the organization. So it also boils down to individuals and how they tackle the matter. What else would you say in closing regarding this matter, Doctor?
I think, I mean, it's what COVID taught us, right? COVID taught us that there was a lot of, yes, the pandemic is there, but there's lots that we should be doing, social distancing and the hand washing and all of that. And it's funny because when you speak about cholera, which was there long before the pandemic, the things that, yes, it's a different disease, different everything, but the simple things like wash your hands, the simple things like, don't just be safe. So for me, it's very much, because we're saying it's a bacteria, we're saying that it is in contaminated. You can spread it just as simply me touching this and then touching the food, and then the whole family gets it. It just goes down to hygiene, which is what also COVID taught us at the beginning stages, that hygiene, have your sanitizers, use them frequently. So that's what people can really do, just hygiene and hand washing, and making sure that they separate what they use the water for. Food, drinking, washing clothes, it must just all be separate.
Absolutely. Thank you so much, Doctor. This was insightful. We appreciate your time. Do have a fantastic holiday. Thank you.